All right, today we're jumping into something really important, a big shift in how we think about diabetes care, especially for older adults. Now, this isn't just a small tweak. We're talking about a real game changer based on the latest standards from the American Diabetes Association. So, to kick things off, let's look at a number, just one number, over 29%. Now, that's a pretty big figure, right? But what does it actually mean? Well, it means that more than 1 in 4 people over 65 in the US is living with diabetes. Think about that for a second. This is absolutely not some niche health issue. It's a daily reality for millions and millions of people. And honestly, that number is only going up. So, for decades, when you heard diabetes management, you probably thought one thing: blood sugar levels, right? But here's the thing: the latest thinking completely challenges that idea. As we're about to see, real effective management for older folks is about way, way more than just that one number on a glucose meter. And that brings us to our first big idea here, moving beyond just blood sugar. You know, diabetes almost never shows up alone, especially in older adults. It's usually tangled up with a bunch of other common health challenges, which can make managing everything, well, incredibly complicated. It's not just one problem you're solving, it's more like you're trying to untangle this whole complex web. And that web includes things that doctors call geriatric syndromes. I'm talking about stuff like cognitive issues, dementia, that can make it tough to even remember your medications, or depression, which can just totally sap your motivation for self-care. And then you've got things like persistent pain or frailty that make exercise feel impossible. And oh yeah, there's polypharmacy. That's the fancy word for juggling a whole handful of different prescriptions every day, which, let me tell you, is a huge challenge and really ups the risk for bad interactions. And that's exactly why the American Diabetes Association is now saying doctors have to screen for all of these conditions every single year. It's so, so important. Because if you don't catch them, they don't just make diabetes harder to manage, they can really, truly diminish a person's quality of life and their ability to live independently. Okay, so all this complexity, it obviously needs a totally new way of thinking. And that's where this really cool tool comes in, the 4Ms framework. Which leads to the big question, right? I mean, with all these moving parts, how on earth can doctors and patients actually put together a care plan that works for a real person in the real world? Well, the answer is by using a specific approach that's designed for age-friendly healthcare. It's called the 4Ms framework, and it's kind of an elegant solution to all this complexity we've been talking about. And here's the absolute core of it. The 4Ms framework, it totally flips the script. It shifts the focus away from how do we treat the disease and instead asks, how do we care for the person? It's all about helping doctors and their patients team up to create treatment goals that are genuinely 100% individualized. So let's do it. Let's break down what these 4Ms actually are, because together they really do give us a roadmap for caring for the whole person. Okay, the first M is for mentation. And this is all about what's going on in someone's head, their cognitive and emotional well-being. But this isn't just some abstract idea. It gets really practical really fast. We're not just talking about screening for dementia. We're asking questions like, can this person's memory handle their medication schedule? Do they have the ability to use diabetes tech like a new monitor? And are things like anxiety or depression making it harder for them to cope and take care of themselves?
All right, on to the second M, and this one is huge for so many people. It's medications.
And here, we're looking at the entire picture. Is there a risk of hypoglycemia? That's dangerously low blood sugar from any of these drugs, because that can lead to falls or confusion. Is the treatment plan itself just way too complicated to keep up with? And this is a big one. Can the person actually afford their medicine? It's all about making sure the plan is safe, manageable, and, actually possible to follow. Okay, that brings us to our third M, mobility. And this is exactly what it sounds like. It's all about how well a person can get around safely and live their daily life. So we're looking at their functional ability to do daily tasks. We're checking for things like frailty or muscle loss. But it also includes things you might not think of, like vision or hearing problems, or even foot complications from nerve damage. All things that could make someone unsteady and increase their risk of a fall. It's just essential for staying independent and safe. And that all leads us right to the fourth and final M, and honestly, this might be the most important one of all. It's what matters most.
This right here is the heart of the whole thing. This is where the conversation centers on the person's own goals and what they want. What do they expect from their treatment? What are their preferences for meals or medications? What risks are they willing to take for a certain benefit? It's all about making sure their quality of life is the top priority and putting them squarely in the driver's seat.
So, as we start to pull all this together, it really all comes back to that one central question. And this is really the beauty of the 4Ms framework. You see, mentation, medications, and mobility, they all affect each other. But the entire framework is designed so that you look at all of them through the lens of that final M. The whole system is built to address that one central question: what matters most to the individual?
So, the big takeaway is this. Effective diabetes care for older adults isn't about chasing some perfect number on a chart if it makes life miserable. It's about creating a personalized, comprehensive plan that's completely focused on supporting a person's overall quality of life.
And really, that leaves us with a final question for you. Because this framework isn't just for doctors. It's a way for you, for your family, to start a different kind of conversation about care. So think about it. What matters most to you or to your loved one on their diabetes journey?